Okay, guys, welcome to our office hour session. Dr. Adam Tice here today. Okay, so here we go. Welcome to office hour session today. We are going to be talking about digestion today. This is my favorite topic, and we can talk about this in a lot of different ways. Let's just unpack digestion a little bit. Let's talk about healthy digestion. And I want to speak specifically to those of you guys that have, if you're dealing with any digestive symptoms or something, I want to go over and again kind of touch on some of the things that I've found clinically and therapeutically useful and effective, and then either remind you of this stuff or teach you about this stuff if it's something that you have not heard of, or if it's new to you. So that's kind of the idea. It's going to be the flow today. Again, kind of conversational style, a little more open-ended. I have some notes to kind of guide us through some general ideas, but that's going to be the lay of the land today. And so, welcome to office hours, guys. This is where we're just gives an opportunity to again share some of the pearls and some of the things that I've found to be helpful after being in the clinic for 12 years, and you figure a couple of things out along the way. And so that's really what the idea is, to kind of pass that through and speed your learning curve up, remind you if you need to be reminded, because we all do need to be reminded, especially about food. It's up and down with everybody, and that's always the ongoing project, because it's the one thing that we do every single day, multiple times a day. So we have to be aware and educated and vigilant and knowledgeable about how we're creating our bodies with the nutrients that we ingest. And we have to understand this, okay? Have to understand this. Food is the mood. You eat, you are what you eat. And so if there are troubles with digestion, there will be trouble eventually in some other system of the body. So if we can catch or recognize a digestive symptom relatively early on in a process, we want to try to intervene at that lowest level possible and recognize that when the body starts giving us those initial signs and symptoms. Body first starts giving signs and symptoms, that's not the disease. You go to the medical doctor, they will diagnose you with GERD or IBS or leaky gut, or some other motility disorder. If there, and there's variations of IBS. There can be constipation type IBS. There can be diarrhea, loose stool, there can be alternating, and kind of any variation in between. There's a lot of different presentations of that. But that's just the label that you'll get from the dominant school of medicine. And then here is your acid blocker. Here is your, here is some Linzess. Here is some acid blocker. Here's your PPI. Thank you, have a nice day. Here's your medicine forever. That's what the dominant school of medicine has to offer. And that's one way to do things. Okay, because not everybody's looking for the root level solution and the root level analysis and really understanding and dialing in your health and optimizing. If you're watching this video, it's likely that you are interested in those things and you're actually taking some action to do those things, especially if you're one of my patients, because this is what we talk about. But if you are out there in the world and seeing this, this may or may not be for you, but if you found your way here and we're talking about digestion, optimizing health, and really understanding at the root level how to create health, how to restore health, and how to sustain and how to maintain health, you do it with healthy digestion. So every conversation that I have and every person that I deal with, in a clinical capacity, in a therapeutic capacity, we're going to be talking about digestion, like guaranteed, 1000%. And probably a little bit each time, each encounter that we have. And because that's the real medicine, that's the root level medicine. So I want to kind of remind again, let's pull our diagram down here, where we want to be working here on our therapeutic order. And the conversation that we're really having today is establishing the foundations for the optimal health, and that has everything to do with diet. So if you have any issue with your health, it doesn't have to even be a serious issue, just not anything ranging from not feeling quite right, or having low energy, or having some brain fog, or having just not feeling like yourself, anything ranging from that level all the way kind of to the other side of the spectrum of an extremely progressed disorder or disease of the digestion, IBS or IBD, even at the far end of that spectrum, would definitely be having symptoms with something like ulcerative colitis or Crohn's, or an IBS where there's inflammation, and there are definitely bowel symptoms, blood or mucus in the stool, things like this. And again, guys, reminder, we're on YouTube right now, so this is not medical advice. That's the disclaimer. If you have any of these symptoms, definitely you need to go get yourself worked up and seek medical advice and medical attention. Okay, what we're talking about is just for educational and informational purposes only. That's what we have to do. That's how we have to do it when we're on the internet and on YouTube. But the information is super powerful. I think you guys get the point there. If you have any kind of issue with digestion or any imbalance with the health, oftentimes, many times, the digestion will be that will be the thing that comes up on the radar that lets you know something's out of tune. And this can be even if you're just stressed out, and they say you can feel it in the stomach, and that effect stress has on the body. Now, is that a diagnosable condition? No, it's not a diagnosable condition, but there are some that we want to start to develop the sensitivity and the awareness where we're paying attention to the signals that our body's giving us, so we can catch stuff before it snowballs and become something different or become something more severe. Okay, we want to really intervene at the foundational level. So number one thing that we would do, things we start thinking, we want to do the good workup. We want to make sure that there is not a pathological condition going on, something like ulcerative colitis, or Crohn's disease. This is where oftentimes I think that the workups and the scopes can be helpful, so you can get a gauge and get an idea of what a tissue looks like, and you can see what's the level of disease progression to get a good baseline assessment on where are we at now, along with a good blood work. And maybe we'll talk some other time about what a good comprehensive laboratory panel looks like, so we can do a good evaluation. That's probably a good session for another time. But we want to have the workup, have the medical workup is my point, especially if there are symptoms going on, if there's reflux going on, if there's burning going on, if there are changes in bowel habits. We want to do the good medicine and have a good workup. So please, 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 if you have these kind of symptoms, make sure you get a good workup. Let me guide you to how to do that, or you need to get into your GI doc and let those guys work out. Because again, that's what the dominant school of medicine is really good at, generally, is the workup side of things. Now, when it comes time to the therapeutic side of things, that's where we're going to diverge. And there there is more than one way to address this. The allopathic prescription pharma route is one route, and that's a good route for a lot of people. Not my people, not me, not in my world. We don't do that. We are 100% nature cure, 100% food is medicine, and that's where we want to work, and that's where we work. And are there therapeutic herbs and nutrients that we do? Yes. That's not what I'm going to talk about today, because that's individualized, and that answer is a little bit different for everyone. So, you know, there could be 1, 2, 3, 4, 5 people present with IBS type symptoms, and those 1, 2, 3, 4, 5 treatments recommendations may be drastically different. There may be some common threads that you see run through those, but they also will be individualized. And that again is what I specialize in, is in customizing and individualizing and personalizing the treatment regimens and protocols, and then following up with those closely and make sure that they're getting better. Because again, what looks good on paper, what looks good or sounds good in the philosophy, when you lay it out and say, you know, some kind of digestive protocol in a cookie cutter fashion, that might work for some 50% of the people, but we don't really work on protocols around here. Everything's personalized. So we need to individualize that, and we need to know that each person has a different baseline. They have a different life experience. They're presenting with maybe similar, but definitely a unique presentation of what their presentation is. So again, there's not a naturopathic treatment per se for IBS or IBD or reflux, or even something you know, maybe more superficial that we think might be food intolerance related, or just an imbalance in digestion. Maybe it's just gas, bloating, some occasional cramping, something like that, not the more severe presentations of that. All of these are in the realm of digestive health, and there's something going on with the digestion if you have any of these symptoms: some gas, some bloating, some reflux, some burning, any changes in bowel habits, the stuff that I'm mentioning. Those are our clues. So how do you know if something's going on with your digestion? Look back, scan back through your last, you know, week or so, month or so, and see if any of this happens. And if it does, there are some foundational dietary changes. That's what I'm about to go over and introduce and kind of review. Maybe for some of you that have heard this before, maybe we've worked this up for your personal case. Let's work this up and go through. So number one, if there's something going on with the food, you know, with anything, the number one foundational thing that I do is I gotta know what the food intolerance is. I have to know what is an individual's food intolerance, and I've spoke about this a lot, and I'm probably going to speak about it more because it's so important to get the food intolerance evaluation. This is, again, working at that ground level where we need to identify and remove the obstacles to cure the food intolerance is the number one thing that I need to identify, because that's what's going to tell me what foods aren't digesting in a person's body. And then again, that's going to alter the biome, create a toxemia, and basically the inflammation will ensue. And that's really the root level, guys, of the inflammatory process. So again, if you say, no, I don't have any digestive issues, I'm all good, but there is perhaps maybe some immune diagnosis that's been made, or a thyroid diagnosis, low thyroid, high thyroid, more commonly low thyroid diagnosed. Maybe there's issue with bone density. Maybe there are headaches. Maybe there's just shoulder pain, knee pain, hip pain, some kind of musculoskeletal pain. Maybe there's changes in energy, or difficulty with sleep, or again, like headaches is really common. You say, no, I don't have anything with digestion, but there's one of those other things, and that's not an extensive list. That's just kind of off the top of my head, kind of naming some of the most common things that you see. If one of those things is going on, then 1,000% I know there's something's going on with the digestion, and there's some imbalance, there's some disturbance in the digestive system. And if those other symptoms are going on, guaranteed the digestion is contributing at the root level. And that can mean different things, but the root level, the digestive contribution is going to mean that there's going to possibly be changes in dysregulation in blood sugars. There could be elevated blood sugars or some kind of insulin resistance, some kind of prediabetes. I call that sticky blood. There can be sticky blood going on, issues with the blood sugar regulation, blood sugars up and down, energy up and down, symptoms up and down, come and go, this kind of thing. The root level, you will see dysglycemias, reactive hypoglycemias, insulin resistance, which that is where there are sugars in the blood and the body, the pancreas is producing the insulin, but it's not getting the message to uptake that, so then the body keeps producing insulin, and then you have these elevated insulin levels and elevated glucose levels in the system, and then that deranges the whole metabolism, puts the body into a storage mode, so that can make losing weight or dropping weight virtually impossible if you're getting the hormonal signal through insulin levels being high and elevated. That's keeping the body, hey, winter's coming, storage mode. You won't be able to drop weight. It will also there's more to that picture. Leptin, is another hormone we can look at, but insulin will give you a pretty good idea of what's going on. And so when we look at that picture, we're looking at fasting insulin, fasting blood glucose, and hemoglobin A1C. And between those three parameters, you can kind of gauge where is the dysglycemia, is it happening? And again, that's a spectrum. Like over here, we have perfect blood sugars, perfect fasting insulin, perfect hemoglobin A1C, no issues with that. And then on the other end of the spectrum, we have diabetes, basically fasting blood glucose over 126, not able to handle postprandial or after eating glucose. It will go really high and hard to bring that down. You'll see elevated fasting insulin. You'll see elevated hemoglobin A1C, so that means over the time, 1 month, 2 months, 3 months, persons walking around with elevated sugar in their blood, and that's what I'm talking about, sticky blood. That is the domain, and that whole area in between there is what I call no man's land. These are the root level things that the digestion is contributing to. The digestion is contributing to that, and the quality of the digestive fire is contributing to that. And that's where we begin to work at to understand, like, how do symptoms start to present? Like, how does that happen? This is one of the main ways and definitely one of the things we need to get addressed is we're working on a personalized regimen and addressing symptoms and addressing digestive issues to heal the digestion. We got to be aware of these kinds of things so you understand. It's like, why is the digestion so important? So what if I don't digest something? Big deal, it'll digest anyway, won't it? Well, not really. Not really. You're going to get a fermentation and a stagnation. You're going to get sticky blood. You're going to get a toxemia in the blood. It will eventually end up in dysglycemias and variations of insulin resistance that are going to basically fuel the inflammatory process. And then how that manifests means what symptom presents. Does it present as digestive symptoms? Constipation, diarrhea, stomach aches, reflux, I don't know. It depends on the person's susceptibility, maybe. It might be headaches, it might be blood pressure, it might be joint pains, it might be thyroid issues, it might be immune issues, autoimmune issues. It can be any of that stuff, depends on who the individual is and what's their susceptibility. But the root level is this what I'm talking about, clearing up the digestion, and especially if there are digestive symptoms. So we want to identify the food intolerance. It's of essential importance. And so let's give some actionable things here, okay? That's kind of, we paint the picture of like why we got to do this. And I think this is important to understand some of the technical information about how the body's working and what is this thing called inflammation, and what exactly is that, and how does all this play into my symptoms? Why does this matter to me in my health and my digestion and getting better? Well, I think that technical information helps. Now let's go over some actionable items. And again, this is not medical advice or cookie cutter advice, but I'm going to go over some foundational things. And I'm speaking to people who would be excluded from what I'm saying right now. Children under the age of 18 would be excluded. If you are pregnant or thinking about becoming pregnant, this needs to be personalized for you. You will be helpful, so listen, but if you're in this category, you really need personal attention and personal recommendations. If you're pregnant or thinking about becoming pregnant, or if you're breastfeeding or postpartum, or if you're a child, those are going to be special cases that really need personal attention. The children need special attention. They're unique individuals. They need their special attention. And moms, pregnant, again, those categories, special cases. So the rest of everybody else, these are some actionable items that you can employ to clean up and tidy up your digestion, and to clean up and tidy up and improve your overall health. These are some high-level recommendations that will take you a long way to ridding your body of inflammation and cleaning the waste out of the digestive system, and cleaning that layer of inflammation up and healing the digestion up. Because guys, remember, the digestive system is amazing, and the body is amazing in its ability to regenerate itself and to self-heal itself. And this is known, and the digestive system is a great example of this. And remember, if we are employing and we're practicing naturopathic and nature cure principles, primum non nocere, first do no harm, we follow. And we believe in the healing power of nature. We believe not in some fanciful way that, some magical way that the body can heal itself, but no, in a very real, concrete way. And the digestive system is a wonderful way to demonstrate this, because the mucosal lining of the digestive apparatus, from here all the way through the tube, that tissue will turn itself over and regenerate itself every 3 or 4 days. And the best example of this is like if you bite your cheek or something like that. You bite your cheek, if you leave it alone and you don't mess with it and mess with it, that will heal up by the end of the day, right? That thin tissue there in the mouth is, you can imagine, that's what's going all the way through the esophagus, into the stomach, and then into the small bowel and the large bowel and out the body. Okay? That tissue is going to be healing itself, and it responds really well and really quickly to these dietary interventions that are aimed to remove obstacles so that we can catalyze and invite that healing power of nature, because that's what the body does. There is cellular turnover, and you see different estimates on this, but I've seen anything. I think the point is that over the course of a couple of years, some say 1 year, some say 7 years, the whole body's going to remake itself, because at the end of the day, there's no new minerals on the planet or anything else. There's a cycle of things, and we're basically all stardust, and those minerals are being turned over, and we're constantly reincarnating and recreating and regenerating tissue in our entire bodies. This is known in the new sciences. Your entire body will regenerate itself, and you will create a totally different body over a course of a few years, 7 years. So this doesn't happen obviously all at once, like boom, one day, every 7 years the body remakes itself. It's more subtle, it's more gradual, it's more It's basically non-recognizable that it's even happening, and that's partly what makes it so magical, is that it's constantly, continuously happening, and the body prioritizes the most important things to the least important things, the inside out, from the top down, and the body will heal in reverse order of which the symptoms appeared. So usually the most recent onset symptoms will start to heal up, and then the longer standing symptoms will heal up and clear up. And that's how we do this. But the take-home message that I do a lot of times with my therapeutic cases, especially when people are starting out, I take people off what I call the usual suspects. And here we go. Wheat, dairy, potato, egg, sugar. Those are my usual suspects. Wheat, dairy, potato, egg, sugar. And we take out we minimize or we eliminate carbohydrates, especially processed and refined carbohydrates. That goes without saying. I did not say this, but this assumes that you're already at the level and you understand and you've cut the crap out of your diet. You're not going and eating out at restaurants every day, eating fast food certainly, and eating boxed food, junk food, crap food that's not really food. Okay, that goes unsaid, that stuff has to leave. That stuff has to go. Refined foods, processed foods, packaged foods, sugars have to go. And then we go after carbohydrates, refined carbohydrates, and grains I put in this category. So breads and wheats and pastas, those are the big things. Depending on who the person is, I'll allow a little bit of rice. And oftentimes I do use an Ayurvedic, a healing Ayurvedic digestive recipe, something known as khichdi. And that's got rice and some stuff in it, okay? So it's not a hard and fast rule, but avoiding the grains, wheat, dairy, pasta, or wheat, breads, and pastas, that's the big stuff that people like and they crave. And again, that's part of that insulin and sugar thing. There's a reason for that, why people crave that stuff. So if you cut it out and you take you take these other items out, and then for a short while take out wheat, dairy, potato, egg, sugar, and let your body heal. Even a week or so on this, and oftentimes I do 30 days on this while I figure out what the food intolerance is, because when I do that evaluation, it usually takes me a couple of weeks to get the results back. So as a point to start to stimulate the self-healing in the body, we'll cut out, minimize, eliminate those carbohydrates, and then take out the usual suspects. And what do we focus on? We focus on the good, lean, clean proteins. And these days I really do like the animal proteins. I like the grass-fed, grass-finished beefs. I really like those. I think people digest those and they have bioavailable nutrients that are very easily absorbed. The meats and the organs, very, very, very nutritious, very, very easy to absorb. And if you have impaired digestion, especially if you have IBS, leaky gut, celiac, Crohn's, you see something like that, the absorption is going to be impaired and compromised. The whole digestion is impaired and compromised. Absorption, assimilation, elimination, that whole process is compromised if there is an imbalance in digestion. So we got to fix that. So we got to know that the body needs absorbable nutrients. So we want to try to get those in, get the good proteins in, and then focusing on the good, clean proteins, and then the good, clean fats, avocados and olive oils and coconut oils, temporarily cutting out the dairy. But as soon as we find out that food intolerance, if you're not dairy intolerant, it can be really healing to start to get some of your calories from the fat and use the fat for the fuel. So that's where, for non-dairy intolerant people, I'm going to be recommending organic grass-fed butters and ghee and things like that as a dense fuel source. It's going to give some good nutrition and be a good fuel mixer. So you're focusing on proteins and fats and minimizing, eliminating the carbohydrates, and that's really what you focus on. And if there is and this recommendation will vary, again, depending on who I'm talking to. So you have to kind of think about, does this pertain to me or not? If you know your digestion is inflamed and you have serious IBS or leaky gut symptoms, raw food's going to irritate you. It's too much fiber. It's going to irritate you. So I'll take a person off the raw food and we'll focus on the soups and the cooked veg and the least reactive things like squashes, and again, easily, things that are cooked, kind of pre-digested, and they're going to be easy to assimilate and onboard. Those things are going to be easily tolerated. And the raw foods and the roughage, if there's inflammation in the system, that's going to aggravate a person. So you got to listen to your body and kind of know your body. And again, if this can get confusing, and if you're totally confused, then maybe we need to come in and do it one-on-one. But those of you guys that we've worked together and you kind of know what's going on, listen to your body. And I encourage everybody to really be their own doctor in that way, and listen to what your body's doing and try to figure out what's best for you. And that's kind of the point of what I'm doing, is giving some higher level recommendations and kind of ideas and things that I've seen be effective, and then to kind of give you something to start with. Focusing on the proteins, focusing on the good fats, minimizing the nuts and the seeds can be hard to digest, so it's a balance between, do you want to get some protein and fat for there, or do you want to stay away from that because there can be difficult to digest and hard to digest. That can be difficult and hard to digest for people. So focusing on the easily digestible broth and the bone broth is all going to be very, very good and healing and easily, bioavailable, good nutrients like this. And then focusing on those complex carbohydrates, the vegetables that are cooked and pre-digested and, again, bioavailable as much as possible. That is a good start. That's basically an anti-inflammatory diet recommendation to start with, or to kind of temporarily do as a little bit of a reboot for the digestive system. So that's a little bit of background on why the digestion is important, what's at the root level underneath the digestive system, why do some people get digestive symptoms and other people get other symptoms, and trying to tie this together with the root level of inflammation, and then how digestion is at the root level and is where we have to speak to and get at and work at to establish the foundations for the optimal health before we start to move up and get more complex, or even before we start to get into, specifically supporting and restoring, maybe working on weakened organ systems, things like that. You've got to do this foundational level stuff, guys. So, okay, that's a good place to pause. Let's pause it there. Please let me know your thoughts or questions. Please leave comments. I really, I like doing this office hours, so you guys tune in, let me know your thoughts, leave the comments there below. And so one announcement, I guess I could say here, I don't know if this is, just kind of popped into my brain, but, if you're a personal patient already, and you have some questions about this, ask me. Let's clarify and personalize for you. If you're watching this and you just found this somewhere, maybe a friend sent it to you, or you just found it through a search or whatever, trying to find some answers for your healing journey, there'll be a link in the description. And I work one-on-one with people, with a limited number of people, small number of people, to give really personalized care, because that's what works. I've been doing this a long time, and I found that's what works best, guys. So if you have questions and you're overwhelmed or you don't know where to start, then you can schedule a consult with me, and we'll hop on a call, and we'll unpack a little bit more about what's going on, and I can kind of connect the dots for you and make a recommendation on how to proceed and stuff like that. So just kind of a little answer there, a little kind of a plug there about, what we're doing. And at the end of the day, I'm a clinician. I'm a naturopathic doctor. I'm helping people. This is how we serve it. This is how we do the deal, people. So you guys have a wonderful day, and we will see you next time. Again, office hours every Monday. Here we go. We're releasing a new episode around 3 or 4 o'clock. I'm doing this at 3 o'clock. By the way, this one's not live. I recorded it today, so I'm about to pop it up. And, but it will be Monday. So adios for now. We'll see you guys next time.